Welcome, medical students, to today's lecture on the topic of anal fissures. In this comprehensive overview, we will delve into the anatomy, physiology, pathogenesis, clinical presentation, diagnostic techniques, management approaches, and recent advancements in the treatment of anal fissures. Anal fissures are a common condition that can cause significant pain and discomfort for patients. By understanding the intricacies of this condition, we can provide better care and improve patient outcomes. Let us now begin our exploration into the fascinating world of anal fissures. The anal canal is the last part of the digestive system responsible for expelling waste. It consists of different types of tissues and muscles that control the release of feces. Proper blood supply and drainage are important for its health. Understanding this anatomy helps diagnose and treat anal fissures. Anal fissures occur when the lining of the anal canal is disrupted, usually due to trauma. Causes include hard stools, inflammation, constipation, and anal intercourse. This leads to pain, spasms, and impaired healing, which can be targeted for effective treatment. Anal fissures cause severe pain during defecation, rectal bleeding, itching, anal discharge, and a feeling of incomplete evacuation. These symptoms can impact quality of life. Accurate diagnosis and treatment planning require a detailed analysis. When evaluating a patient with symptoms suggestive of anal fissures, it is crucial to consider the differential diagnosis. Several other anal pathologies can produce similar symptoms, and a misdiagnosis can lead to inadequate management. Conditions that should be considered in the differential diagnosis include hemorrhoids, perianal abscess, anal fistula, anal cancer, inflammatory bowel disease, sexually transmitted infections, and rectal prolapse. Differentiating between these conditions requires a careful history, physical examination, and may involve additional diagnostic investigations. By recognizing the variations in clinical presentation and characteristics of these conditions, accurate diagnosis and appropriate management can be achieved. The physical examination is crucial for diagnosing anal fissures. Examiners should examine the anal area visually for fissures, redness, tags, etc., while also palpating the external sphincter for tenderness or spasm. Digital rectal examination and, sometimes, proctoscopy or anoscopy are necessary for further evaluation. Competence in conducting a comprehensive physical examination is vital for proper diagnosis and treatment of anal fissures. In certain cases, more tests may be needed to determine the cause and severity of anal fissures. Sigmoidoscopy and colonoscopy are common procedures that directly view the anorectal area and colon, assessing the fissures and searching for any related issues. Understanding these test results helps create an appropriate treatment plan. Initial management of anal fissures involves non-surgical approaches such as dietary modifications, stool softeners, and bulk-forming agents. Topical therapies and sitz baths can provide pain relief and promote healing. A holistic approach can minimize the need for surgery. In cases where conservative measures fail or severe/chronic anal fissures are present, surgical interventions such as lateral internal sphincterotomy and fissurectomy may be necessary. These procedures alleviate sphincter spasm, enhance blood flow, and promote healing. While generally successful, potential complications must be considered and discussed with the patient. Meticulous surgical technique and postoperative care are key for optimal outcomes. Anal fissures, though not life-threatening, can lead to complications such as chronic fissures requiring advanced surgery, fecal incontinence, and wound infection. Proper recognition and management are necessary for optimal patient outcomes. Prevention and long-term management of anal fissures require lifestyle modifications aimed at minimizing the risk factors associated with this condition. Patients should be educated on the importance of a well-balanced diet rich in fiber and fluids to promote regular bowel movements and prevent constipation. Regular exercise and physical activity are beneficial for maintaining overall gastrointestinal health. Avoidance of excessive straining during bowel movements, proper anal hygiene, and timely intervention for any underlying conditions, such as inflammatory bowel disease or chronic diarrhea, are fundamental in preventing the recurrence of anal fissures. By adopting appropriate lifestyle modifications, patients can significantly reduce the risk of developing anal fissures and improve their overall anal health. Empowering patients with knowledge about anal fissures, their etiology, clinical features, and management options is key to achieving successful outcomes. Clinicians must employ effective patient education strategies, including clear and concise explanations, visual aids, and written materials, to ensure patients fully understand the nature of their condition and the importance of adhering to the recommended management plan. Topics that should be covered during patient education include dietary modifications, proper bowel habits, perineal hygiene practices, and the significance of adherence to medications or treatment regimens. By promoting patient engagement and fostering a sense of responsibility for their own care, clinicians can enhance patient compliance and improve treatment outcomes. Medical research has made significant progress in the treatment of anal fissures. New methods, such as botulinum toxin injections, platelet-rich plasma therapy, laser treatment, radiofrequency ablation, and improved medications, show promise in promoting healing, reducing pain, and preventing recurrence. Anal fissures significantly affect patients' well-being and require careful evaluation and treatment. It is crucial to understand the various aspects of anal fissures, including anatomy, causes, symptoms, diagnosis, management, and recent advancements. Through a holistic and individualized approach, clinicians can effectively relieve symptoms and prevent recurrence. Ongoing research offers further hope for improved treatment options. As aspiring healthcare providers, it is important to stay informed and provide evidence-based care for patients dealing with anal fissures. May your knowledge bring positive change to their lives.